I'm Dr. Marcus Schaubacher, and I'm the CEO and president of ECRI. Our mission is to advance evidence-based and effective healthcare globally. I got to know a small organization called Floating Doctors, who provide primary healthcare to the indigenous people of the northeast of Panama. Many of the villages are only accessible by foot and by boat, and it fits right into our efforts in making healthcare more accessible to everyone, particularly those who are usually underserved. We need to understand what these practitioners who are here facing on a day-to-day basis so we can make our best possible recommendations. The key issue for the Floating Doctors is that they operate in a very, very difficult environment. So we choose our topmost system safety expert, Shannon, who is really focused on human factors when it comes to processes and safety. The second part was important to have somebody on the team who has actually done work with public health clinics in remote areas in difficult settings. So that's Julie. And then we brought our president of the Institute of Safe Medication Practices, Rita, with us because dispensing of drugs in these difficult conditions was a key issue for us.
My name is Shannon Davila, and I am a nurse, and my title is Director of Total Systems Approach to Safety. ECRI is well aligned with Floating Doctors. Both of us have a mission to improve the care of healthcare globally. And just like any healthcare organization right now, health resources are really limited. We're here to help assist them with choosing the most effective outcomes that can be sustained into the future.
My name is Julie Thomas, and I am the registered nurse, patient safety analyst with our HRSA program. As a nurse, I'm always trying to learn more about culture, learn more about care delivery, how to improve care delivery, and see how the rest of the world does healthcare, because I can take that back to my clinics.
My name is Rita Jew. I am the president for the Institute for Safe Medication Practices, also known as ISMP. Because Floating Doctors have teams of volunteers that comes and go on a regular basis, it's very helpful to try to come up with some standard operating procedures that are simple and easy for folks to follow so we can help them establish more standardized care for the patients.
Panama has a fantastic healthcare system if you are in Panama City, and there's a lot of health tourism, actually. But then you go to the indigenous people who, not different than anywhere else in the world, are usually disadvantaged. And you come to remote places where there's zero infrastructure. There's no roads, there's no electricity, there's no running water, there's no septic system. And those communities are usually the hardest hit by the disadvantages.
ECRI has a lot that we can bring to support organizations like this. We have to be flexible in healthcare, taking into consideration the needs of the patients, not being culturally tone deaf, because there are certainly limitations in this environment, which the literature and the evidence may not describe or take those into consideration.
We're manning the pharmacy in here in the clinic that we're running, and we're actively brainstorming on how we can improve the process and make things more efficient.
I was very surprised at the limitations of resources that Floating Doctors had. One thing that I was completely surprised about was the use of an Instapot as the autoclave, and it makes sense because it's steam sterilization and pressure. There's actually studies out of University of Arizona Dental Clinic that do show that it is effective, so I'm going to keep looking into that.
We want to take a tiered approach. Some things which are easy to implement and have a high impact, we want to see implemented before we leave. And then more systemic, longer term things, which would require more dialogue and recommendations. The first one, quick win, already implemented, was that we separated the counting trays from general medicine and antibiotics to ensure that there's no contamination of antibiotics for patients, for example, who have a penicillin allergy. And then something which is a longer discussion and will require some investment is looking at sterilizing the instruments, which are currently done in an instant pot.
One of the most important things that we can focus on revolve around communication, because there's so many miscommunications that happen in patient safety. You need to assure that the other person receiving the information understands it. We saw that with a lot of the providers, and I was really pleased to see that.
We have a really, really good team that was down here. I wouldn't expect anything else or anything less from ECRI. ECRI employees, people that work at ECRI, were all very mission driven. And so I'm not surprised that the team would come together down here.
I appreciate being able to have this relationship building and just appreciate everyone's different skill levels, interests, and we're all a team.
For ECRI, health equity is a key topic. ECRI is here for everybody. Our mission is to advance evidence-based and effective healthcare globally. We don't discriminate on if you're small or large. If your mission and our mission, which is providing safe and effective healthcare, align, we're here to help.